Good morning, everyone. So first of all, a little bit of background about this study. It is an evaluation of the government's welfare rules. It is the first of its kind to track welfare recipients, singles, couples, lone parents, over a 2-year period. We undertook this study in order to better understand how welfare recipients experience the welfare rules and how they make ends meet. By doing a long-term study like this, we've been able to compare the experiences of those who remain on assistance, those who leave voluntarily, and those who are cut off. The study helps to explain in part the puzzle that is the current BC economy, how we can continue to see steady economic growth, record low unemployment, declining caseloads on the one hand, and yet simultaneously deep and persistent poverty and rising homelessness. As you'll see, the study establishes some important connections between welfare policies and homelessness. We launched the study because we wanted to assess the impact of the tough new welfare rules introduced in 2002. And we were particularly interested in ensuring that our study included the kinds of people who usually get left out of government evaluations. For example, those without phones and homes. We know that welfare caseloads have been in decline since 1995. And they took a sharp decline after the government's new welfare rules were introduced in 2002. Now, according to the government, this is a straight good news story. But it has never put adequate studies in place that would allow it to make such bold claims. And in the absence of such studies, the Economic Security Project has examined the reasons for the declining caseload and the consequences for those unable to get or keep assistance, and a much more nuanced and often disturbing story emerges. As many of you will know, in 2006, the Economic Security Project produced another report called Denied Assistance Closing the Front Door on Welfare in BC. Denied Assistance examined the new rules and procedures for applying for income assistance. It found that the application process was systematically discouraging, delaying, and denying people in need of help, and that many experienced harm and homelessness as a result. That study strongly established a connection between how hard it is to access welfare and rising homelessness. This Living on Welfare report today is in many respects the companion piece to Denied Assistance. It documents the impact of welfare rules on those who are already on welfare, have been on assistance for some time, and who are designated as expected to work, meaning the Ministry of Employment and Income Assistance considers them employable and requires them to be actively searching for work. Throughout the report, you'll find quotes from the study participants and profile boxes that capture some of their stories. The stories are powerful and sometimes maddening and tragic. They drive home how terribly arbitrary and impersonal the welfare system can be, but they also communicate a host of ideas for making the welfare system better, for how it can offer real support.
So here's what we found at the beginning of the study. The majority of the participants had cycled on and off welfare for a number of years, and on average had been on assistance for a total of 8 years. A major point, we found extensive and debilitating health problems and disabilities. I'm going to throw some stats at you, which you can find on page 32 of the study. Almost one-half reported long-term chronic physical and mental health conditions, such as diabetes, cancers, advanced stage pulmonary cardiovascular disease, multiple sclerosis, arthritis, hepatitis C, and a range of psychiatric disorders.
The frustration that we feel as advocates of pouring work into getting somebody with the most basic stability, a little room to live in, an income that allows them to eat 2 months or 2 weeks out of every 4, to be able to access prescribed medication, and then to have them cut off welfare and see our months of work just disappear again. most people don't realize that when someone is cut off welfare, they no longer have access to medication, which means that most of the people I'm waking up in the street have chronic bronchitis, recurring pneumonia, severe, very severe depression, and they cannot access the antidepressants that would allow them to move forward in a system that barriers them. They cannot afford the antibiotics that would halt the bronchitis. They lie in the street dehydrating with a written prescription for antibiotics, sweat-soaked in their pockets because they've got a fever of 104 degrees. They cannot get off the street to get a cup of water, even. This is not what you expect in a civilized community. We've seen times when this was not happening. We have seen times when supervisors in ministry offices were empowered to make common sense decisions. I think of a young woman down in the downtown east side. I met her on the street in the nighttime about a block away from here, where she was selling her body on the street. And she had been cut off welfare because she did not have a doctor's letter stating that she was HIV positive. She could not get the doctor's letter because the chaos of her addiction made this possible. So she was no longer living inside. She was out on the street that night looking for some man who would take her home and in exchange for sex would give her a bed to sleep in that night.
When you ask the minister about today's study, that they like to point out that they have this homeless outreach strategies now with people like Judy who find people. But my sense is that most of the people engaged in that work tell you that it feels like a hopeless game of catch-up, and that there is this paradoxical situation that we find in the report, which is that they're having to go back out and find homeless people who are homeless because of the very policy choices that have been made.
Although our primary purpose at BCPWA is not advocacy, we do provide advocacy services to people on disability benefits. And we find that overlooking this report that it is very true to our experience. People living with disabilities like HIV have to fight for access to their basic welfare rights. One of the key things that we're working on right now is children under 18 do not qualify for persons with disability benefits or status. Technically, they are unable to receive the monthly nutritional supplement that HIV-positive persons with disabilities receive so they can maintain their health and the need for effective HIV treatment. BCPWA has fought to get 5 children on access to the supplement. And for the last month, we've been fighting for a very ill 15-year-old girl who's HIV positive who shouldn't have to fight for this right. Also, we'd like to point out the practice of lifelong banning. Lifelong banning from receiving welfare for offenses against the welfare system is currently under review with the Supreme Court of British Columbia, and the court is to decide whether the ministry's banning process is in violation of the Canadian Charter of Human Rights and Freedoms. In a more general context, the current system creates barriers for accessing benefits, and it puts people at risk of transmitting or spreading HIV and other communicable diseases. The survival sex trade is a good example of this. And in the downtown east side, we know the rate of HIV is about the same as Botswana's, and is estimated to be as high as 30%. A working system should not require our advocates and advocates of other agencies to access benefits that should be readily available for people.
So here's what we found at the end of the study period. In answer to the question, where did the participants end up? When the final interviews were conducted 2 years later, We interviewed almost 3/4 of the initial group, 45 people, which is a very high retention rate for a study like this. At the end of the study, and you see this laid out starting at page 37, almost 2/3 of the participants, 29 people, were still in receipt of income assistance. 1/4 had left welfare voluntarily and were still off. 11 of those 12 were employed. The rest, 9%, or 4 people, had been forced off welfare during the study and were still cut off as of the last interview. A major finding: of those who remained on assistance at the end, 2/3, 20 people, had been recategorized, either as PWD, a person with a disability, or PPMB, or temporarily excused from employment with a medical condition, a point to which we'll return in a minute. And while 4 people were cut off assistance as of the final interview, in fact, a total of 7 people were cut off assistance for various durations over the course of the study. So, what do these findings say about the government's new welfare rules? First of all, living on welfare is hard. It's very hard. In general, our study suggests that the welfare system is inadequate and inaccessible, and that society pays for this in many ways. The study shows why some people on assistance feel compelled to resort to panhandling, survival sex, or various illegal activities, and why some remain in or return to abusive relationships. All of these things came up in our study all too often. And the findings point to the various ways in which society at large pays for welfare's failings, through higher health costs, higher policing and justice system costs, and increased demands on innumerable community and charitable agencies. For example, the people in the study used emergency rooms far more frequently than the norm for the population as a whole, and yet each time they spend a night in the emergency room, they cost the healthcare system more in one night than they would receive on welfare in a month. What about the practice of cutting people off assistance? Each year, hundreds of people are cut off assistance in BC. According to data acquired through a Freedom of Information request submitted by Jean, in 2006 alone, almost 500 welfare files were sanctioned and closed, meaning individuals were cut off. In the vast majority of cases, the reason given was non-compliance with employment plan, the employment agreements that expected to work recipients must sign with the ministry. In some cases, people regain assistance after a month or two, while in others, people may be cut off for extended periods of time or indefinitely. Our study suggests that far too many people are cut off assistance, and for inappropriate and unfair reasons. Being cut off has helped neither the 7 people in this study nor society generally. When reviewing their cases, it is clear that what they needed and desired was support in tackling their addictions, help managing their hepatitis C and other health problems, and stable housing. They have experienced the policy stick without the needed supports. All were deemed as expected to work, yet our analysis indicates that none were in fact job ready and none had paid employment when they were cut off. All 7 had a history of addiction and struggled with serious health problems. When they were cut off, all were effectively homeless, at least 2 as a direct consequence of being cut off. For the 4 who were still cut off at the end of the study, soup kitchens and food bank usage almost doubled. When asked how they made ends meet when cut off, the one woman in this group reported staying with family and friends, going to food banks, and reported prostitution as her main source of income. 2 men were living rough on the streets, using food banks, skipping meals, and stealing. Their health had deteriorated. One man, we call him Frank in the study, although we've changed everyone's names, had been evicted from his stable SRO room and was now living for free with a friend. He was demoralized, had no income, was using soup kitchens, and had returned to alcohol use for the first time in many years. And one of the women who was cut off temporarily during the study, we call her Lorraine, returned to an abusive relationship and was subsequently beaten so badly that she was required surgery and was hospitalized for a few months. We all pay for this.
This is one of the main findings of the report. It's not something new, but it certainly is revealing. Under current welfare rules and benefit rates, women often feel they have no choice but to stay in or return to abusive relationships or to engage in survival sex or prostitution. 1/3 of the women in this study who reported being in an intimate relationship, which was 4 out of 12 women, said that they experienced abuse at the hands of their partners during the study period. 3 of these 4 women stayed in or returned to an abusive relationship for financial reasons. 1/5 of all women who participated in this study reported engaging in prostitution or survival sex at some point during the study. For 4 of these women, this activity was tied directly to some of the welfare changes, such as a waiting period, being cut off benefits, etc.
And people who are already in crisis do not have the resources to fight for their basic rights. We know at this time there are about 2,000 people in this province who should be on antiretroviral medication for their HIV. And a bulk of them live in the downtown east side here, and they just can't get access because they do not have food security and they do not have homes. Just to put this in context, it is very expensive. Each new HIV infection is going to cost the system in excess of $750,000 per case. So we're talking about serious health dollars here, and many of these could be prevented. We know we can prevent HIV. And we also know that HIV-positive people living in poverty are less likely to seek treatment and more likely to spread the disease. And no one should have to beg for welfare.
Our study concludes with a long list of policy recommendations, but just to highlight 4. First, that welfare rates must be significantly increased and indexed to inflation. Second, the government must make a commitment to categorize welfare recipients appropriately and in a timely manner so that people are not held in the expected to work category for years with less income and forced to jump through employment hoops that are fundamentally inappropriate to them. Third, the regulations and administrative practices that permit people being cut off, even temporarily, must be revisited. They are too arbitrary, they are applied inappropriately, and cause unacceptable hardship and harm. And fourth, more meaningful employment supports must be provided. If more people are to move from welfare to work, they must be provided with housing, help with addiction and health problems, better access to quality, affordable childcare, and a level of individualized education and employment supports that can make this possible and that truly represent a path out of poverty. As with previous Economic Security Project reports, we reiterate the need for more accountability at the Ministry of Employment and Income Assistance. We urge that the Ministry and really government overall change its overarching goals from a narrow focus on welfare caseload reduction and moving people from welfare to work, and move instead to the broader goals of poverty reduction and elimination and health promotion.
Would you recommend basic income for everyone?
Well, for starters, welfare rates need to be significantly higher. You got to have welfare rates accessible and welfare benefits that are accessible and that are set to some rationale that makes sense, where the rates and the benefit levels are tied to the actual cost of living. Because right now, they're just arbitrarily set by government and they remain frozen for years at a time.
Do you want to change the world? Go beyond protesting. Register your opinion on ourpolls.ca. Let it be counted. On Elections Day, don't give away your right to make decisions. Demand an ongoing direct democracy. When you participate on our social consciousness, we will change the world.